So Dr. Jemima, karibu sana.
Thank you so much. Thank you, Caroline, for hosting us today. I just wanted to thank you everyone who's made time. I think we can pray and then start. I was hoping to give a few minutes to the women to be able to join, but as you've rightly said, they'll meet us along the way. I'm in a vehicle, so I'll not be able to put my video on for now. So I think to start off, we can pray, and then I'll let Caroline continue. Yeah, so dear Lord, thank you for bringing us together. I pray that even as we start this meeting, that the people it is targeted for, Lord, that you're going to find them, that you're going to be able to speak to them, use all of us in a way that they'll be able to understand. And Father, Lord, may we be able to demystify autism and be able to do more for your people each and every day. We thank you and honor and bless your holy name. In Jesus' name we pray. Amen. So by way of introduction, my name is Dr. Jemima Kariuki. I'm an obstetrician gynecologist by profession, and I'm the founder and the CEO of Wills for Life. I will allow everyone on the panel to be able to introduce themselves, starting by Caroline, then Dr. Kerubo, who's our main speaker of the day, and God will guide us through the process. So Caroline?
Okay, thank you very much, Daktari, and thank you to all of us who have joined us. My name is Caroline Wadege. I'll be your moderator for the day, and I want to thank every last one of us who's here. We have with us our parent, Caroline, who will introduce herself as Daktari is logging in, and then we move on.
Thank you, Carol. Good evening. I'm Carol Nyagote, a mother to 3 children, and I have a son who is on the autism spectrum. Yeah, thank you.
Thank you, Carol. We appreciate that very much. Daktari is joining us. She's just informed me she's logging in. And once she logs in, she should be able to also introduce herself. So today we want to, as Daktari rightfully put, Dr. Jemima, today we have 2 doctors. So as Dr. Jemima rightly put, we want to talk about autism. We want to demystify it, know what are the signs, what are the symptoms, what should we look out for? And there's no better way than first hearing from a caregiver who has walked the journey till now. What did she see? What has she learned along the way? And we'll pick it up from there. So Carol, I want to introduce you. I want to give you the stage to just talk to us a little bit about your journey. Karibu, Carol.
Thank you, Carol. Thank you for having me today. I am Carol Wangui Nyagote, and I'm a mother to 3, and my son, the middle child, is the one who is on the autism spectrum. He turned 7, and he has been a blessing in my life. So he was born well. I had no complication during the pregnancy and even during delivery. And Carl continued to meet all his milestones until at the age of almost 1 year, he had acquired speech. everything was on track until one day he started crying continuously. Like he would cry continuously to a point where the apartment we used to live, the neighbors told they told the watchman to come and check if there was any abuse that was going on, because the child would cry continuously. So I didn't, it didn't scare me. And then all of a sudden the speech started to disappear. He had acquired some vocabularies, but one by one they started to disappear. And at that time, I think I didn't have any concerns. But one day, as we were taking him to the hospital, he had a flu, and I took him to the hospital, and the pediatrician saw him, and she raised some concerns and told me that I needed to do further investigation. So immediately she told me, instead of following through with what she told me, I went into denial. I started comforting myself. So even when I went for him to be checked, I was looking at other kids and nilikuwa yasema, oh, at least wangu hayuko hivi, wangu hayuko hivi. Not knowing that it's a spectrum, no two children can be the same. And sadly, during that time, I lost a lot of time that could have been used in early intervention. So some of the symptoms that started to appear was he lost his speech, and then there was continuous crying. For at least for him, he continuously cried. It started with would cry for like there's a time even it went to 1 hour, and and then he stops for a few minutes and then he continues. Like everything was irritating him. And then there was sleep deprivation. He started not sleeping well as he was as he used to. And then he became hyper. He became hyper. And sadly, at that time, I didn't know about diet control, not giving him wheat. Now, because he loved chapati, I thought every time he would cry, I would go and make chapatis and give him, and he would eat a lot, and the cycle would continue. So he had a lot of hyperactivity. So when I went to get roots, that's how I was referred to their main hospital in Muthaiga, and there's a test that they requested that I needed to do, and at that time no one could. It was a hearing test, yeah. And when we went to do the test, sadly he couldn't stop crying, and he wouldn't allow anyone to put anything in his ear. So I was told to keep him awake and take him the next day. But he didn't, he stayed awake, and the next day he didn't sleep. So sadly, I went without doing that test. So that is when now I came to learn about autism. And almost immediately, I went into denial. I didn't take any further measures since that time. At least for some time, I was just comforting myself, it'll get better. I'll do this, I'll change this, I'll do this. Those were like, I'll change maybe the clothes, maybe I just trivial things, not knowing that there were other things I could do, like speech therapy, occupational therapy. So it was such a long time, because that was at least when he was like 1.5, and I started now taking some steps when he was around 4 years, 3 years, 4 years. So I took a lot of time before I started any intervention, and sadly, that is very precious time for any child on the spectrum. Yeah, so the journey journey has its own ups and downs. It's a challenge, but one thing I know is we continue to learn every day. We continue to learn how to better help our children. We learn more about them because no children are alike. So as a parent or as a caregiver, every time you have to learn your child, rely on God to also teach you how to parent these children. They are unique in their own ways. And also there's a lot of information on how you can come up with some measures like dietary control, their therapies, and all this you can find online and also on platforms like the ones we have here. So if you're on this journey, it's not an easy journey, and still it's not very hard to do. And unlike before, where we didn't have a lot of information, there were no platforms. When you're told autism, you didn't know where to begin. It was like a foreign thing. We thank God that there's a lot of information, there's a lot of advocacy that is happening. And so even as a caregiver, you have a lot of information on your hands. Yeah. Carol, I don't know if there's anything I've left out.
Okay, thank you, Carol. We appreciate just sharing your journey with us. I know for a caregiver who's listening to us and it's your first time to hear about autism, and even those who've been on the journey, there are a few things you may be, just thinking about. Have I seen this? And now probably you'll be more aware what to observe in your children, even in your relatives. And yeah, thank you, Carol. I know the questions, once we are done with the session, if there's any one of us who wants to ask you a question, we'll ask you a question then. So asante sana, Carol.
Thank you, Carol.
Okay, now as we have heard Carol's story, we want to, she's told us some of the signs and she's talked about the precious time that she took. But I think one of the reasons why most of us parents go into denial, sometimes it's also lack of information. And that's why we are here today. And we thank Dr. Jemima and Wheels for Life for just, having us do this together with them so that we can enlighten all of us on autism. With us today, we have Dr. Lillian Kerubo. Daktari, you are very welcome. She will tell us more about autism, the signs, the symptoms, and the diagnosis. And before she starts taking us through it, we request her to introduce herself. Karibu, Dr. Lillian Kerubo. Daktari. Please unmute.
Hello.
Hello, Daktari. Karibu. We can hear you now.
Asante. Is it my time to start?
Yes, kindly introduce yourself and then we carry on. We just go on with the program.
Okay. So good evening. My name is Dr. Lillian Kerubo, a pediatrician who is interested in the development and behavior of all children. Thank you for this opportunity, and I hope we'll all learn together. Thank you.
Okay, Karibu Daktari. Now, please tell us what you prepared for us today. What is autism? What are the signs, the symptoms, and the diagnosis?
Just a minute, let me share my screen. So just as I'm preparing to start the screen sharing, I want to appreciate the mother who has just spoken, because a lot of times as doctors, we don't get to hear the other side of the story. We don't get to hear how a diagnosis impacts a family or a mother. And I'm very appreciative of the fact that you, Carol, I think was her name, is brave enough and courageous enough to share her side of the story and how the diagnosis impacted herself and her family, and how it's a continuing journey. And it's always good to hear this, especially for us as doctors, because sometimes we are very quick, we just give a diagnosis and then refer for therapy, and nobody takes the time to see how that diagnosis affects a family. So I'm glad to hear about that. And I'm also glad to see that we have participants from all over the country. A lot of times we these kinds of neurodivergence doesn't get a lot of attention, especially in Africa, because people are quick to dismiss that it's just a behavioral issue. We just need to beat somebody. Yeah, so I'm very happy to see all the participants. Okay, I think I'm ready to share now. I hope I have. Oh, I'm not able to share. Carol, host has disabled screen sharing, so maybe you can share from your end.
Oh, okay. Sorry. Let me just share from my end.
Okay. Thank you. So that's just the first slide. We can go to the next one. I'll not read everything, but we can just I'll just touch on a few important things, because I assume that the audience is mostly parents and people interested in autism, and not necessarily clinical people. So we don't have to go into science and too much of biochemistry. So autism then is now known as autism spectrum disorder, and medically it comprises a group of disruptive neurodevelopmental and behavioral disorders that range from mild to severe. So that is the language that is used in the books. However, I watch a lot of I follow a lot of autism children, well, adults who are now they're adults, but they had been diagnosed with autism when they are children, and most of them seem to not prefer this wording. So majority of them prefer autism to be known as a neurodivergence, which basically just means the brain functions differently. And I think that's better in terms of reducing the stigma, because once you tell somebody that they have a disorder, or once a parent hears that their child has a disorder, as Carol has shared in her testimony, there's a lot of stigma and a lot of denial that goes into it, and the child ends up losing when it comes to therapies and activities that will benefit the child. So majority of the children who are diagnosed with autism and they are now adults are telling us, the doctors, how they would prefer to be defined, and is that they would just like to be defined as people who live with a neurodivergent brain. So basically it just means they are human beings first and not the diagnosis first, and that they would like the brain to be understood as a different type or a different style of brain functioning. So they experience a lot of challenges when it comes to speech, social, emotional, cognitive, and behavior realms of their lives. And as Carol has mentioned, it's a spectrum. Not all children in the spectrum will have deficits in speech. A lot of autism children are able to speak. So it is a spectrum, which means that every child will present differently. There are those who will have full speech, but may struggle with making relationships. There are those who will have flourishing relationships, but may struggle in class, in a typical class, for example. And there are those who will have, who will be geniuses in the class, but may struggle to express their emotions or may struggle with a few behaviors. We usually see it commonly in boys. It doesn't mean girls don't get it. It just means it's easier to pick it in boys more than in girls. And autism is passed on from generation to generation. So it's very likely that if there is a child with autism, there is either a parent or an uncle or a grandparent who was also or is also in the spectrum. It's we do not know the cause so far, but there are some researchers that have gone into autism, and so far we know that autism can be found in when you have other diseases. So for example, there's a disease known as Fragile X. It's usually a disease of boys. So they inherit, as the name suggests, a fragile X chromosome from the mother. And when you have this illness, most of the boys with this illness will present with autism. And then there's a disease also called tuberous sclerosis. That's what the TS means. If you're diagnosed with this disease, it usually comes with autism as part of its package. And there's another illness also known as Smith-Magenis. I'll not go into the details of that. So children are usually born with autism. However, we usually pick it up much later when now they are expected maybe to speak and they're not speaking, or they're expected to play with their friends and they prefer to play by themselves. So it doesn't mean that the disease started at the time that it was noted. It just means the time when it was noted is the time when the expectations that were on the child have not been met. And that's when people start wondering, oh, what is it? Why is it not happening? And then now they probably go to the doctor and the doctor will probably diagnose the autism. So it's not that the autism started at 9 months or at 3 years or at 4 years. It just means that's the time it was picked, but the child has probably been struggling for a while before the diagnosis is made. Can go to the next slide. So let's start with the abilities, because most of the time we like starting with what somebody is not able to do. But children or adults who are in the spectrum are able to do a lot of things. They are able to understand, contrary to what most people assume. Most people assume that they are not able to comprehend what is going on around them, or they are not able to understand what the teacher is teaching. But that's a myth. Most people in the spectrum are actually very intelligent. However, they may not express it, because most of the time we expect people to express their intelligence either by their speech or by reproducing or regurgitating exactly what it is they were taught. However, children in the spectrum learn differently and they express their intelligence differently. So we need to structure our schools and our classrooms to extract the intelligence of these children. They are highly adaptable. This is because they mostly learn by modeling and by observation. So they are able to adapt their behavior and their life based on their environment and their surroundings, which can be an added asset depending on their circumstances. They are also very trainable, unlike what most people presume. They can be trained. They can be trained into a skill. They can be trained to get some talent or some special ability. They also have a heightened sense of smell and other senses. So we have about 7 or 8 senses. We have the common 5, which is smell, touch, hearing, tasting, and seeing. And then we have other senses like introspection, vibration, and proprioception. So introspection is about knowing what is going on inside you. And this is one of the senses that most people in the spectrum will struggle with. They're not able to understand whether they're feeling sad or angry or whether they're feeling good within their body. And then we have the sense of proprioception, which is when you need to know if your eyes are closed or your ears are blocked. You need to know whether you are facing forward, backwards, left, or right. You need to basically have a direction sense or a position sense. That's another sense that most people in the spectrum will struggle with. And the other one that sometimes they struggle with is a sense of touch. This is because textures are very different. They're interpreted differently when it comes to the child in the spectrum. So when though it may be easy for any typical person to touch, let's say something that is a little bit rough, let's say sand, you know, for a typical person, they'll just touch it, play with it, and then move on. But to the child in the spectrum, it may feel a bit different. It may actually even feel painful. So that's why you'll notice that when it comes to touching things, they're very selective with what they can touch and what they cannot touch. However, there are some senses that they are very good at, or they have, you know, they have a better appreciation for. And some of these are smell, you know, the sense of smell, the sense of sound. They appreciate them very much. They are also very ambulant and dexterous. So autism is not like, for example, cerebral palsy, where you'll find a child with cerebral palsy may have challenges in maybe not just their understanding and their social development, but they may also struggle with walking and running and, you know, doing other activities. But the children in the spectrum are very active. Those of you who have children in the spectrum, I'm sure you can testify that those children are usually very, you know, up and down. They can climb, they can jump, they can run, they can dance, they can do a lot of physical and a lot of, you know, things that require a lot of manipulation. And that's a strength that can be used maybe to direct their career choice or their choices in the subjects that, you know, they should be involved in. They also have a good appreciation for art, for music, and for sports. Next slide. So these are some of the symptoms or the signs that you might be able to pick up. It's important to note that children in the spectrum look just like their peers who may not be in the spectrum. There's nothing physically distinguishing unless they have an underlying disease, such as I mentioned, the Fragile X. Children in the boys who have Fragile X may have a bigger head compared to their colleagues, or they may have bigger eyes or a bigger mouth. And then children who have tuberous sclerosis may have some spots on their faces and on their body. But basically 90 to 95% of children who are in the spectrum will look exactly like their peers, of course, in regards to the race or the tribe that they come from. So there's nothing physically distinguishing. Next slide. So a challenge that most of children in the spectrum will have is when it comes to their speech. And the commonest presentation is that they will have delayed speech. However, you will notice, or we usually notice that they are also often late to babble. So most babies will babble at the age of 4 to 6 months. So babbling is that sound that babies make when they are they're driving a car through their mouth. So they make a sound like, and then saliva usually comes out of their mouth. Most babies do that from the age of 4 to 6 months, but you'll find children in the spectrum may delay in doing that. So these are stages in the development of speech. Typically, we are trying to get a picture of it right from just at 3 years or at 4 years, when usually these children are diagnosed with their first one. Again, most typical babies, their first one between 8 and 12 months. Actually, a child in the spectrum may not be able to do that. Then once they start speaking, you may notice that a child in the spectrum may have limited vocabulary. We usually calculate or estimate the number of words that a child typically has. So you'll find that when you're 2 years old, you're able to make a 2-word sentence. So for example, a 2-year-old child may be able to say, "Mom, come," or "want milk," something like that. Of course, not necessarily in English. It can be in Kiswahili, it can be in mother tongue. But basically, you might find a 2-year-old child is able to make a sentence that consists of 2 words. A child in the spectrum may not be able to do that. They may have 1 word. They may be able to say maybe 5 words in total. Maybe they have vocabulary of mom, dad, the name of a sister, or the name of a favorite toy. So at 2 years, we roughly estimate that a child should have a vocabulary of about 50 to 100 words. So you can see there's a marked reduction. And then as they grow older, you may find that the child in the spectrum has a limited sentence and phrase construction. So at 5 years, most children are able to give you a story. They're able to tell you, I went to the market, I saw this, I saw that, we bought this, and then we came home, I ate this. So most 5-year-old children will be able to do that, but a child in the spectrum may struggle to give you a story. They might tell you maybe, we went to the market and that's it. But the target or the goal is to have them be able to put more body in their speech. And these are some of the targets that we aim for when these children go for speech therapy. Another thing we may observe with children in the spectrum is that they may repeat words or repeat consonants. And this can be confusing to the clinician who is focused on getting a child who does not speak absolutely for them to say that this is a child in the spectrum. A lot of children in the spectrum are able to speak. However, you may notice a few differences in the way that they speak. They may be repeating the same words over and over again. So for example, if you tell a child in the spectrum, count from 1 to 10, maybe they are 3 years, 4 years old, they may be able to do that because counting from 1 to 10 just requires you to have a rote memory. Just a minute. Counting from 1 to 10 requires you to have rote memory, which means once you have established 1 to 10 and you store it in a part of your brain, you can easily extract it. So majority of the children in the spectrum, after a period of time, they are able to repeat words that they have stored in their deep brain. So they're able to, for example, count from 1 to 10. They're able to say A, B, C, D. They are able, some of them, they're able to sing a song. A lot of them, when they come to the clinic, they're able to sing songs like Cocomelon. They're able to, you know, sing along with the gadget or whatever is singing. So, however, you may notice that there are specific words that they keep repeating over and over again, and sometimes those words may not be appropriate in the situation. So, for example, maybe you are asking a child, what are you doing? And then they may say something like, my name is Fred, for example. So you need to be very keen in not just, is my child able to speak, but how is my child using the speech to communicate? Another specific unique thing we see with children in the spectrum is they like repeating instructions. So you may tell a child, go bring me milk, and then they repeat it, go bring milk, go bring milk, go bring milk. So some of those things we observe, or if you say something, they echo. You can say, Fred, come here, and then they also repeat, Fred, come here. They like repeating what they have heard. Perhaps it's a way they are trying to use to learn how to speak. Sometimes the differences we notice in them is not in the words that they say, but in the pitch that they use and in the pace and the tempo that they use when it comes to speaking. So when it comes to speech and language, it's a whole topic. And I think there are experts who have gone to school to just learn about speech. So the point I'm trying to put across is autism is not just about inability to speak. There's so much more about speech. Speech is not just saying words. It's, are you using those words appropriately? Are you compounding those words together with gestures, together with body language, together with facial expressions? Are you using the common or the typical tone that is expected for that kind of social setting? Are you using the grammar correctly in respect to the language that you are speaking? Are you using are you using other things when it comes to older children in the spectrum, like teenagers and adolescents and young adults? At this age, we expect them to be appreciative of things like satire, things like sarcasm, things like hyperbole, things like, if it's African language, you expect a teenager or a young adult to have appreciation for proverbs. for sayings and for some maybe folklore. So if a child in the spectrum is coming at teenagehood, the way you will assess them is very different from the way you'll assess, for example, a 3-year-old or a 2-year-old. So the expectation is very much varied depending on the age, the cultural setting, and the environment that the child is in. Next slide. So another area where we see some challenges when it comes to children or people in the spectrum is in their social interactions. And social interactions depend a lot on the culture and the environment that this child is in. For example, the first bullet point there talks about pointing. And this is something that is usually commonly seen at around the age of 9 months. At 9 months, most children are able to point. So they will either point at a person or something that they're interested in, or they will point at something that they're enjoying. Maybe they are trying to tell other people, please come and see what I'm looking at. It's very enjoyable. So commonly we see children in the spectrum having a delayed or absent pointing. And this is a clue to later on, perhaps in life, if nothing is done, if therapy is not offered, or other ways are not offered to this child, it's a clue to later on a person who may struggle with forming relationships. Because for you to form relationships with other people, you need to share in your experiences, you need to share in things that make you happy, you need to point at, you need to say something that you would like, for example, in a relationship, or you would like to a place to go, or something to share. So delayed pointing is an important clue when it comes to assessing a child who may have autism. Some of them, not all of them, may have difficulty with eye contact, but not all of them. Majority of them will look at you. They don't have an issue with that. Sometimes parents come and say, I don't think my child can hear. This is because most children in the spectrum are very focused in what they are doing. So for example, you'll find a child in the spectrum playing with toys. They are very focused in the toy. And if you call them, they might not respond. It does not mean they did not hear, but it just means their focus at that particular time is in the toy. So sometimes people may think that the child is deaf, but it's not that they're deaf. It's just that they are immersed in what it is that they are doing, and they prioritize differently, and they may not respond to you if you call to them. Oftentimes, a child in the spectrum may look as if they are far away. You may be with them physically in the room, but their thoughts and their feelings are in a different zone or in a different place. They may not be very welcoming to strangers and to other people. All children are very scared of strangers from about age 6 months to 1.5 years, but typical children will overcome that fear, especially if this stranger is in the presence of their parent or somebody that they know. However, children in the spectrum may struggle a little bit in being open to strangers. We also notice that children in the spectrum have minimal interest when it comes to things that typical children are interested in. So you may find that they are very focused in one thing, to the extent that they don't have focus or they don't have interest in other things. So for example, a child may in the spectrum may be very focused in cars or toys, a specific type of toy. So to the extent that if you present a different type of toy, they're not interested in it, they don't care for it. But if you give them what it is that they like, they will respond to it. So it's a two-way thing. They are interested in what they're interested in. So we need to have an approach or a unique way of getting them to be interested in something else. So let's say they're in a classroom, they may be interested in coloring very much, but let's say the teacher is trying to teach addition or is trying to teach subtraction. So a different way maybe need to be used to get this child to be interested in something else other than the coloring. So most of the time they prefer to be alone, and this continues even to adulthood and to teenagehood. You may find that the child who is constantly by themselves, reading on their own all the time, may be in the spectrum, because sometimes forming relationships, starting relationships, speaking to people constantly may be a challenge for them. Sometimes these children are brought by teachers and not parents, because the teacher will come and complain that this child does not participate in class. So sometimes it's the teacher who makes the referral to the pediatrician or the developmental pediatrician. Next slide. So when it comes to their behavior, this is one area where most parents and most relatives of children in the spectrum will struggle with, because people in the spectrum have their own unique way of appreciating life and of experiencing life. And these behaviors are not necessarily bad. They are just unique to them. And we only intervene in behaviors that are we call them maladaptive. So behaviors that may cause harm, but majority of these behaviors are not harmful. They are just unique, and we just need to accept them. So you may notice a child in the spectrum having a lot of repeated movements. Maybe they flap their hands when they're happy. Maybe they jump around when they're happy. Maybe they keep turning around. Maybe they roll their eyes a certain way. Maybe they move their hands a certain way. Maybe they do, interesting things to their faces. Maybe they keep going to a place that has a specific sound or a specific vibration or a specific wind. Maybe they keep opening and closing the windows. Some of them keep opening and closing the tap because maybe they're sensory seeking. They're looking for that sensation of, water or vibration. So some of these behaviors are not necessarily bad. They just need to be understood and accepted. They also have specific interests that we've talked about. So perhaps they love going to a specific park, so they will insist on going to that park every day. Perhaps they like listening to a specific type of music, so they will insist on that music every day. Once they have established a routine, if that routine is deviated from, it will usually cause some tantrums. They may cry a lot, as the parents talked about, a prolonged cry. They may, become very irritable and very angry, and sometimes they may become violent. And this is because their brain works differently. As we've mentioned, they prefer routines and they stick to a routine. So if you don't prepare them and you suddenly change their routine, you should expect some consequences for that. They prefer short and repeated acts, and this is one of the ways we train the teachers on how to educate these children. Instead of having a long lecture like the one I'm offering right now, it's easier to give them short, repeated ways of learning. So if it's addition, give them a short example and keep repeating, and they will understand that. Sometimes some of the children in the spectrum run away. And this is something, of course, that can be dangerous, but there are ways of countering that behavior. We've already talked about taking time to warm up to people. So this is something to bear in mind if you're going to introduce this child to a classroom or a church or a mosque. Do not just take them one day and expect them to just get into the routine of a church or a mosque. So it has to be gradual. You have to prepare them, and you have to be patient as they get used to the routine and the people in the new place that you have taken them to. We've already talked about aggression, sometimes to self, to others, or to property. Next slide. Yes, another area that we see a challenge in is in their emotional expression. Oftentimes they have outbursts, either due to anger or sadness or irritation. And this is mostly because of the limited communication that they have. If they're not empowered to speak on what they are feeling or what they're experiencing, they will have a limited avenue of expressing themselves. So usually for any child, their default method of communication is crying and tantruming. But before we empower these children, we give them vocabulary to express themselves and give them avenues of expressing their feelings. then the tantruming and the the destructive behavior that we see with children will reduce. However, for a child in the spectrum, they may struggle a little bit more and a little bit longer. But if they are empowered, if they are given the skills, if they are given the knowledge on how to express themselves, you will find that their tantruming goes down and down and down. So the tantrums that we are worried about are tantrums that last more than 15 minutes and that happen more than 3 times a day. That's a tantrum that should cause concern. If your child is tantruming for more than 15 minutes and it happens more than 3 times a day, that's a concern. Most children in the spectrum will struggle to establish an attachment. However, once they establish an attachment, it is an attachment that is very difficult to break. So you'll find that most nannies, especially will struggle with making a relationship with a child in the spectrum. So a mother with a child in the spectrum, most of them will say they have fired and hired more than maybe even 50 nannies in a space of 2 to 3 years. And this is because attachment is usually difficult to establish. But you'll also find once they have attached to somebody, it's almost a permanent bond. It will be very difficult to break that attachment. And if you break it, this child will regress emotionally and socially. They also have difficulty interpreting social cues. So these are not children that you expect to read body language, for example, and interpret it the way you expect them to. So we were talking the other day with some friends about how our parents used to make us behave in church or anywhere in any social setting, and they usually say that their mother had this specific look, that hard look, that if you see your mother giving you that look, you immediately stop doing whatever you are doing and behave the way you are expected to behave, especially in church. And for children in the spectrum, they may struggle with that hard look. You may look at them and expect them that you're communicating with that hard look, but a child in the spectrum may not interpret that hard look the way you are expecting them to. So you may need to be more straightforward and tell them, stop doing what you're doing, come and do this instead. So sometimes they may have unique responses. You may be at a funeral, but somebody is struggling to interpret that this is a sad occasion. So they may have other things that are not appropriate for that social setting. So they need to be trained when it comes to certain social circumstances. Next slide. When it comes to their intelligence, as I've mentioned, most children in the spectrum are very intelligent. However, the ways in which we measure intelligence may not be favorable to them. So like if you give a child in the spectrum a question paper and you expect them to just regurgitate answers, and you expect them to give an oral essay or something like that, you may score them poorly, but it doesn't mean that they did not comprehend the knowledge that they were supposed to acquire. It just means the knowledge was not given to them in a way that they synthesize and in a way that they understand, and the methods used to test them were not standard. However, there are children in the spectrum who do struggle cognitively, especially those who have severe autism. They may struggle to understand and they may struggle to comprehend. So those are children who will require a lot of support. Next slide. So this is just a picture of possibly a mother and a son who might be in the spectrum. The son might be in the spectrum. And you can see from that picture that the boy looks a little bit, distant from the mother emotionally. If you try to read that face, you may not be able to exactly tell what emotions and what thoughts the boy is having. In comparison to the mother, if you compare with the mother looks a bit sad and it looks like she's focusing on something in front of her. We don't know what it is. But the point I'm just trying to make there is that, the boy appears to have that faraway look that many of the children in the spectrum may have. Next slide. So what challenges do families and relatives of that may have a child in the spectrum face? In the family, there's always a lot of tension, misunderstanding, stigma, and judgment. And this goes straight from the time the child is diagnosed. It is not surprising to find a family having separations after a diagnosis of autism is made. And this is because of all the misunderstanding that goes on behind autism, especially in Africa, where we have a lot of sensationalism, a lot of misunderstandings, and a lot of speculations about some of these neurodivergent conditions. So you will find perhaps the husband and wife are not on the same page when it comes to the therapies and the care of this child going forward. And it may bring a lot of fighting, a lot of misunderstanding, and there may be separation. Sometimes the separation happens at a parental level, where the parents are from a different generation that doesn't understand this neurodivergence, or they may blame this on other things. And so the family becomes discordant and conflicted. And that's why most of the time when we have a diagnosis of autism, we usually refer most families to family therapy, so that they can also be coached and counseled on this new life-changing diagnosis. Because from the time the child is diagnosed, and even before, life is never the same, and life will never be the typical life that most people may have envisioned before the child was diagnosed. So it's important that families go for therapy, go for counseling, go for training, go for coaching, so that we don't have the diagnosis causing a separation or discord, because these children end up noticing. You know, we may think that the children don't notice, but they will notice, and they will end up blaming themselves to be the reasons why the family broke up, to be the reason why mom and your grandparents and parents are not speaking. All of a sudden, people cannot go to Shago because the son or the child has been diagnosed with autism, and this child will end up blaming themselves for the rest of their lives. And it's important that the mental health of this child is taken into account, because majority of children in the spectrum, when they become young adults, when they become teenagers, they struggle with a lot of depression, they struggle with a lot of self-stigma. And the genesis of this is perhaps how the diagnosis was handled, and how the family unit, which is the closest unit that this child will ever have, how they responded to this diagnosis. So it's very important that the family stays united and stays as a welcoming and a warm place for this child who has neurodivergence. Oftentimes we think that it's the parents who struggle the most with this diagnosis, but it's actually the child who struggles the most with this diagnosis. They struggle even more than the parent. So it's important that we keep the child at the center of all care. They also struggle academically. We have mentioned several times that these children need to be trained differently, need to be assessed differently, and need to be taught differently. Otherwise, they struggle a lot with the knowledge. They struggle with how it is being delivered. They struggle with a lot with understanding the concepts that are being taught in school. They also struggle socially. We mentioned that starting relationships, keeping relationships is difficult. So if they're not handled well, they may just prefer to be loners and to keep to themselves, which may end up harming them in the end. We all know that man is not an island. We are not meant to be lonely. We are meant to have social relationships. So it may harm them mentally and emotionally if they are sidelined or discriminated against because of their differences. They may also struggle legally. Some of these children, as we've mentioned, they wander, they explore. They usually have no awareness of boundaries, and so they may trespass or they may commit some misdemeanors. And if nobody is there to speak for them, you'll find majority of them getting arrested. And this is common with young adults and teenagers. They may get arrested, and if nobody is there to speak for them, they may end up in the institutions, in jails and juvenile centers, perhaps for a fault that is not their own doing. It's just because their brain works differently. I follow some of these families who may not be in Kenya, perhaps in the US, And there have been complaints of children who are in the spectrum being mishandled by the police just because the police did not know the cues or the behaviors of people who are in the spectrum and ended up perhaps harming them physically. So it's important that these children are recognized, not just by their families, but by police officers, teachers, clinical people, anybody basically who comes into contact with a person in the spectrum. Children in the spectrum are, they're just like their peers when it comes to health. So they may get the same diseases that the other children in the countries that they're in or in the social settings that they're in get. However, because of limited communication, they're usually underdiagnosed or misdiagnosed. For example, a child have a normal flu, just the kawaida homa that all children get. But because when they go to the doctor, the presentation may be a little bit different. You know, they may be crying excessively because it's a new environment, or they may refuse to be examined. So you may find such a child being overdiagnosed or underdiagnosed, not because of the illness, but because of how they presented. These children, some of them have limited appreciation for danger, so they may get themselves into injuries, like if they run into the roads, they may be harmed by a vehicle. If they don't have an awareness of a swimming pool or a lake or a dam that is near their home, they may go there and they may get harmed. So those are some of the challenges that we face. Next slide. So what are some of the solutions that we offer to families and people living in the spectrum? So number one is to have more of these talks and more of this awareness and campaigns and more of this discussion so that we understand more and learn more about the spectrum, and not just about the science and the biology behind it, but also how it impacts the lives of people who are diagnosed to be in the spectrum. It's good to see, to listen to adults who were diagnosed autism spectrum when they were children, and learn about what was good for them and what was not good for them, and what helped them and what did not help them, so that we can tailor the therapies and the interventions that we offer to these children in a bid to help them adjust to be adults. Children in the spectrum should be loved and accepted for who they are and not for what they could be. A lot of parents and caregivers struggle with a child who has been diagnosed with autism, not because of how the child is, but because they feel or they think the child will not become who they had thought they would. So a lot of parents, when they have a baby, you have dreams about your baby even before they're born. Maybe you wish for them to be a musician or a dancer or a chef, whatever it is, the dreams that you had about your child. And then when the diagnosis comes, sometimes we think that all those dreams are shattered. This child will never be who I planned or who I thought they would be. And so that manifests in anger towards this child that you have. It may manifest in withdrawal of love and withdrawal of care for this child who is in front of you. But we need to reconcile that we need to love and accept this child that we have in front of us, and not the child that we had in our heads or in our dreams before the child was born. And a lot of children in the spectrum are able to do virtually anything in this world. There are no limitations. We know of children, adults in the spectrum who are doctors, who are pilots, who are lawyers. So there is no limitation just because a child has autism. The challenge is in the support that we offer these children and the empowerment that we offer these children. But with the right kind of support, the right kind of environment, and the right training, these children are able to do anything that they would like to do. So for parents who have young children, it's important to be aware about the developmental milestones what is expected of every child at a certain age, so that you're able to seek early care the minute you notice that there could be a problem. A lot of children in the spectrum are offered speech therapy, and this can start even at home. You don't have to wait for a speech therapist. I know some of these therapies are very expensive and they're not covered by insurance and not even in NHIF. So sometimes I meet a lot of parents, especially when I'm in the hospital that I work in, who are not able to afford a lot of these therapies. So there are certain things that can be done at home without needing a speech therapist. Small and simple things like reducing gadget time, interacting more with your child, going to face level with your child and looking into their eyes, reading for your child, allowing them to interact with other children of their age group, supervising their play. All those are small things that can be done to improve the speech of this child, in case speech therapy is something that is either too far or too expensive for you. Children in the spectrum need to have a routine. Don't just wake up one day and announce that you're going to the village to Shago and expect compliance. They need to be prepared. They need to stick to a routine, even if it's Christmas Day, even if it's their birthday. If you have a routine that they wake up at 6, then they sing, then they eat breakfast, then they brush their teeth, you need to stick to that routine every day, regardless of what day it is. And that's when they thrive. Some of them require special education, and adults require some assistance.
Dr. just a minute. I'm requesting us to kindly mute. Okay, sorry, Dr.
Okay. Next slide. Next slide, Cara.
Yes. Sorry, I was hoping it.
Yes. The other therapies that are available for them are behavior modification strategies. I know most of us grew up in African homes where if you didn't behave in the way that is expected, the immediate thing was to be beaten. For children in the spectrum, this may not work. This is because, as we've said, their brain works differently. The way they understand and the way they comprehend is very different from a typical person. And in any child anyway, beating is a last resort. We do not encourage beating of any child, but more so a child in the spectrum. So this is because they may interpret that information as when you are angry, the way to express it and the way to get rid of that anger is to beat somebody. So they will copy that behavior, and you'll find them beating other children and even beating you as the parent. So there are other ways of modifying their behavior. If you feel their behavior is not what you would like, you can use other ways. Nowadays we have behavior therapists that are being trained on how to modify the behavior of children in the spectrum. You can use reinforcement, positive reinforcement, and negative reinforcement. Positive reinforcement is when you train them on the behavior that you would like to see of them. So let's say you are trying to stop them from throwing things. You can model what you would like them to do. You can model how to put things in the appropriate place. And when they do it, you reward them. That is positive reinforcement. So they will feel good that they have been rewarded for doing the right thing, and they will keep repeating it or keep doing it. And the negative reinforcement is when you withdraw something that they like in a way, in an effort to get them to do what it is you want them to do. This of course, you will need a child who is understanding a little bit for you to use this method. So for example, if a child loves watching TV a lot, or a child loves playing a certain game, you can tell them you won't have this game for 5 or 6 days until you learn how to put the toys back in their box. So until they learn how to put toys back in their box, you withhold the game or the TV. And when they learn to be able to put the toys back in their box, you can give them what it is you had taken away from them. As we've mentioned, these children thrive in routine. So you need to create a timetable for them. Even if they're not able to read, you can use pictures instead of words so that they know what happens at each time. And if you're going to change that timetable for whatever reason, maybe there has been a death in the family and you need to travel to the village, maybe it's Christmas time and you need to take a vacation as a family, you need to prepare this child. Get videos, get pictures of the new place that you're going, show them to this child, explain that we shall be in the car for 6 hours, and then after the car, we shall go to a new home, and show them the pictures of the people they expect to see. If it's a wedding, show them videos of weddings before the wedding, so that when they go to the church or the mosque for the wedding, they are not shocked. Because when they get shocked in a new place, they will throw a tantrum. And then most parents will respond by beating them, which makes the child angry, and then they tantrum even more. And the cycle continues, and the child never learns, and the mother becomes frustrated, and then they decide we shall never go to church ever again, or we shall never go to a wedding ever again, which now has totally thrown the family off balance. So manage those transitions even before. When you are expecting something to change, handle it with your child even before the change happens. Of course, I don't have to say that these children should not be abused and they should not be neglected, just like any other child. But when there is limited understanding, it's very easy for a family to neglect or abuse this child, but that should not happen. If you feel as a parent or as a caregiver, you are struggling mentally to give this child the love and the care that they wish, there are ways, there are places that are available to help you. You can see a psychologist, you can see a counselor, you can see somebody who you can share your burden with, because it's not easy taking care of a neurodivergent child. It's not easy to receive that diagnosis. It's not easy to love the child. It's not easy to give the child the care that they would like. And we accept that it's not easy. It's not embarrassing, and you should not be embarrassed or be scared to say that I need help in learning new ways of caring for this child that I have been given, or that I'm employed to teach, or that I need to treat. Let's say they're in the hospital, and there are places that you can go and get training and get skills on how to approach and how to interact with these children. When you notice that your child loves certain things, so long as they're not harmful, you should try and give them those things and try and reduce on the things that they don't love. So let's say your child has demonstrated that they don't like bright lights, then you should modify the house or the classroom to dim the lights, or to use different types of lights that this child can respond to. If you notice that your child does not love loud sounds, then you should modify the environment to be a place that doesn't have noises or loudness, or give them those noise cancellation earphones, just basically to make their life a little bit more comfortable. Because when they are uncomfortable, they will tantrum, and then they will frustrate themselves and frustrate you. Next slide. So these are examples of things you can do in the house. Let's say your child is struggling to complete their meal. A lot of children in the spectrum are very picky eaters. They will only eat maybe pasta or ugali, dry ugali, without vegetables, without protein. And we know that they need to eat a complete meal so that they grow healthy, and so that they are also their chemicals in the body, the hormones in the body are also balanced. Because when the vitamins and the hormones are not balanced in the body, it can also cause them to behave in a manner that is challenging. So it's good for them to eat healthy, balanced meals. So a lot of them struggle with eating vegetables, for example. So you can draw for them a chart or get pictures of charts like this. And when they complete their meals, you tick or you put a star. And then after they do it for maybe a month, you can reward them with something that they like, maybe a toy or a trip to a place that they like, so that they are encouraged to complete their meals and to eat their vegetables. If it's vegetables they are struggling with, if it's fruits they are struggling with, to complete their fruit intake for the day. Next slide. This is an example of a chart you can use for bigger children to incentivize them to be kind. A lot of children in the spectrum, as we mentioned, will struggle with relationships, relating to people, being kind to people, sharing their toys, saying good morning when they wake up, smiling at other people, letting other people pass, saying excuse me, saying thank you, saying please. So those are things, if you notice your child is struggling, make a chart with the specific things you want them to do. And remember to use positive language as opposed to negative language. Don't tell a child, stop jumping up and down. Instead, say, sit down. So empower them with what it is you want them to do, and use that language when you're making these charts. And then when they actually do what you want them to do, make a star or make a tick. And then at the end of it, you can qualify it and say, maybe if you do it 35 out of 40 times, you will get a reward. And they'll be encouraged to do this, and they will keep doing it until it becomes part of their life. You know, just like the quote says, you do it, you're interested in something, it just becomes an interest. You do it 7 times, it becomes a habit. You do it 21 times, it becomes a character. And when you perfect that character, it becomes you until you do it automatically without even thinking about it. Next slide. This is another one you can use to train them to use the potty. A lot of parents struggle in training their children to potty train, you know, weaning them off from diapers to potty. And you can use a chart. You don't have to use words in case your child is not able to read. You can use pictures. You can get pictures from the internet of a child using a potty, you know, put it in the bathroom, in the family bathroom, so that when the child goes to the bathroom, they can see what is expected of them. And when they actually do it, you reward them for it. Sometimes they may not be able to sit in the potty on day 1. Maybe all they'll be able to do on day 1 is to remove the trouser, or you know, to even just go to the bathroom in the first place. You should recognize those small efforts, and those small incremental efforts. After some time, you'll find that they'll be able to gradually use the potty. It may take time. It may not be a quick transition like a typical child. It may take time. A lot of them may, you know, still be in their diapers by age 5, by age 6, by age 7. So it calls for a lot of patience when it comes to potty training. You can use charts, you can use videos, you can use, you know, even modeling. A parent may need to go with the child, you know, the same-sex parent may need to go with the child to the toilet, and let the child see the parent, you know, using the toilet, so that they can get used to what is required to use a toilet or a potty. Next slide. There are alternative therapies that are, you know, available. Some of them are still being researched or are still being studied, so they have not yet been, you know, stamped or approved. So a lot of children respond to hydrotherapy, which is basically a fancy word of playing with water. So, you know, so in case, you know, some of this may be very expensive for the average African family, but you can just put water in a basin in the house, you know, warm water in a basin in the house, and let the child play there for a few minutes, give them their favorite toy, and you'll find that they come out of that water happier. And a happier child is a child who can behave better, is a child who can behave in a manner that is expected of them. So if water makes them happy, let them, you know, put water in a basin and let them play there for a few minutes. It gives you even room as a parent to breathe and do something that benefits you, so that for those few minutes, you are not wondering, where is my child? What is the child doing? Are they destroying something? Are they having a tantrum? Are they doing something, you know, bad? So, you know, give them water if they respond to water. Of course, some of them do not like water. So you need to know which child loves water, which one will respond to hydrotherapy. Music therapy. If your child loves music, if you notice that your child loves music, it may be classical music, it may be rock music, it may be a different genre of music. Give it to them let them relax with the music. Let the music calm them and soothe them. Some people have talked about hyperbaric oxygen therapy. It has not yet been approved, so these are some of the things people are attempting to do to see if it will help with the challenges that of autism. Animal therapy, if your child loves pets and animals, you can buy them a pet, you can buy them a cat. Of course, if they are not allergic, you can buy them a dog. A lot of people have reported that animals, especially dogs, are able to calm them down, because one of the things that people in the spectrum struggle with is anxiety, fear of the unknown, fear of people, fear of being in public settings, fear of being shamed, or fear of behaving in a different way and therefore attracting negative responses. So animals or service dogs are able to calm them down with some of these challenges. Art therapy, giving your child a color, giving your child a paper, a paintbrush, giving them other things of art can help calm them and can help teach them valuable lessons that you're trying to teach. There are a lot of research going into stem cell therapy. This is currently not available in our country, but there are countries that are trying those things to see if it will help with the autism spectrum symptoms. This is not for every child. Again, it depends on the setup, and a lot of this is experimental. So we are not saying it works, neither are we saying it does not work. It's a lot of trials going on. So it has not yet been approved, but there are parents or people trying to cure autism using stem cell therapy. When it comes to diet, there is no specific diet that is recommended, unlike what is said out there. What we say is know what your child is allergic to, or what your child makes your child's symptoms worse, and avoid it. So you'll find that some children may be sensitive to gluten. So when they eat gluten, it irritates them, and then their symptoms become worse, their behaviors become more challenging. So if you notice this pattern in your child, it may be wise to avoid gluten. In some children, it may be dairy. In some children, it may be a particular dye or a particular chemical in a spice. To some children, it may be a particular fruit. To some children, it may be a particular, in some children, they don't like their soup and their carbohydrate touching. So once it touches, they will not eat. So learn your child. The message here is to learn your child. If you can, go for allergic tests so that you know what your child cannot tolerate, and then you'll be able to withdraw that from their diet. But largely what we say is feed your child healthy meals, a variety of healthy meals full of fruits, full of vegetables, a lot of organic food, and a lot of healthily and soundly grown foods, or foods that are of benefit to the body. Avoiding junk food and avoiding processed foods is healthy and is advisable, not just for people in the spectrum, but for all people. Next slide. Yeah, so these are just some of the services that I offer. Because of time, I think we can end there. And I'll hand over the program to Caroline to take over from there.
Okay, Daktari, thank you very much. We appreciate the presentation. I'm sure we have learned a lot. And now we want to open the floor for questions. If you have a question, this is your time. Let them start coming in. And as the questions start flowing in, there is something that, Tari, you mentioned about eloping stroke wandering. What are some of the strategies that a caregiver who has a child who elopes what are some of the strategies that they can use to contain or to make sure that that is reduced?
Thank you very much for that. That's a very critical challenge that most children in the spectrum will have, because they can elope and run into the road and then get hit by a vehicle, or run into a dam or a lake and then they might drown. So it's a very dangerous thing when your child is eloping or wandering. So some of the things that people can do, you can make sure that where the child is always secured. So let's say they're in the house, make sure the doors are locked. And these children are very smart. They will learn how to unlock that door. So you need to make sure that when you are unlocking that door, the child is not seeing you unlocking that door. So either you cover the door with a curtain, so that when you are unlocking it, you put your hand behind the curtain and the child is not able to see how you are unlocking that door, because they will quickly learn how to unlock that door. The other thing is to make sure that there are always gates and fences. Let's say it's a compound, let it be a fenced or a gated compound, so that the child doesn't just wander off. In another setup, maybe with more resources, you can put this child with a tracker. You can put a tracker on this child. It might be a watch, a specific watch that has the GPS. It may be a bag, a school bag that has a GPS coded into it. It may be a chain or a bracelet that has a GPS, so that you're always able to know where exactly your child is. The other thing is to notify the security people around you. It might be the watchmen, it might be the soldiers, the policemen in your nearest police station. Let them know that you have a child who wanders or elopes. Give them a picture of the child, so that in case they ever come across this child, they know that this is a child who has wandered off, and they know where to take back this child. So it calls for a lot of collaboration with not just the neighbors, the nannies, the security men, the soldiers, and the policemen around you. So those are some of the strategies that you can use.
Okay, thank you very much. There's a question coming in. Is echolalia bad? Is delayed echolalia a bad thing?
No, it's not bad. Not all children will have echolalia to begin with. Not all children will do that. The echolalia is just basically repeating what you have had. Like if you say, come here, then the child repeats, come here. That's what we call echolalia. Not all children will have that. And it's not a sign or a milestone that we use to say that this child is developing typically or atypically. It's just that we notice a lot of children in the spectrum have echolalia. So I would say delayed echolalia is a bad thing, because we don't expect children to have echolalia. It's just that we notice children in the spectrum will have, majority of them or some of them will have echolalia. So I wouldn't say it's a bad thing. It's not a bad thing.
Okay.
Then somebody here has said, we can tell moms that if there's something they could have done different, even in pregnancy, as most blame themselves. Honestly, there's nothing you can do as a mother to prevent or to know about autism, and that you're carrying a baby with autism and maybe change. These are things that sometimes are beyond our control as parents. As I said, this is genetically most of the autism is genetically passed on. So it would be very hard to prevent it. Of course, it's good to know about, the genes that you carry, and not necessarily by doing a genetic test, but just observing your family, observing the family of your partner. If you notice that, not just about autism, when it comes to things like diabetes, high blood pressure, it's good to know that these are some of the challenges that this family deals with. These are some of the challenges that this family deals with, but it's not something that you can do. Let's say you are pregnant and say, oh, now I will not go to this place, or I will not eat this food, or I will not watch this kind of movies. So so that you can prevent autism in your child. It's virtually impossible. Then somebody has asked about autism in teenagers and adults. Is there any specific therapy for these persons on the spectrum? Yes, a lot of behavior therapy is available for teenagers and adults in the spectrum. These are people transitioning into adulthood and into independence. So they need a lot of support in that area. So for example, if you want to train your child on how to live independently, you need to give them a targeted intervention. Let's say you want to train your child on how to groom themselves, how to apply for a job, how to buy or shop for things in the market, so that you're trying to help them to become independent. So these are some of the things that are available for teenagers and adults, training them on how to live by themselves, how to keep the house tidy, how to wash clothes, how to cook in a safe way, how to, the daily requirements of life, the daily activities of daily living, how to, take a bath, how to comb their hair. If they need to go to a job, how to get to that job safely, training them on how to take a matatu or how to call an Uber, or how to, go on a boda so that they can get to their workplace. Those are some of the interventions that are offered to teenagers and adults, because at this stage we are aiming for independence, we are aiming for functionality, and we are aiming for, having a full life, even going out to socialize with their friends. Those are some of the things that they may need to be trained on, and you may need to do a simulation. Like, you can call for a small party and coach him that this is how you say hello to people, this is how you listen to people, this is how you respond to what somebody has said. So those are some of the specific therapies for those ones. Any other question?
There's one here. This will sound a bit weird, but there's a discussion that happened somewhere saying there's a certain vaccine that caused the high rise of autism, I believe, especially children born from 2019 onwards. Is there research of that sort?
Yes, so there was somebody did a study, a certain doctor, I think his name was Wakefield, and he did a study with the MMR vaccine, because there was a lot of MMR vaccine is a vaccine against measles, mumps, and rubella. That's what MMR stands for. It's a live vaccine. So the people who said since their children received that vaccine, that's when their children got autism. And there was a doctor who did a study that kind of supported that allegation or that rumor, and it caused a lot of concern in the health world. Because measles, mumps, and rubella, of course, are diseases that we would not like children to have. So when it was alleged that the vaccine caused the autism, there was a lot of reduction in vaccine uptake. Not just that particular vaccine of MMR, but all other vaccines. A lot of parents boycotted vaccines because of that allegation that the MMR vaccine caused autism. And it became a very big challenge, because a lot of children now started getting measles, and we all know that measles is not a very fun disease to have. So later on, another study was done by Lancet that countered that study that Wakefield did, and a lot of Wakefield actually committed a lot of research flaws and a lot of research illegalities when he did that research of the MMR vaccines. So later on, Lancet published another study that countered and actually disproved the initial research that had been done by Wakefield. However, a lot of damage had been done. To this day, you will find a lot of parents refusing vaccines, a lot of parents telling their friends, do not go for these vaccines because they will cause autism. And there's a whole movement actually known as the anti-vaccination campaign that is worldwide and causes a lot of challenges. But what I will say is there is no relationship between any vaccine and autism as of today. I will highly encourage all parents to go for vaccines that are important in prevention of diseases such as measles, pneumonia, malaria, yellow fever, COVID vaccine that recently came into the market, hepatitis A, hepatitis B, chickenpox vaccine, meningitis vaccine, tetanus vaccine. All those vaccines are safe, they are sound, they have been proven to be effective in prevention of diseases. So there is no relationship with any vaccine that is being offered right now to the children by this government, and I would highly encourage all parents to take their children for vaccination.
Okay.
Yes.
Thank you, Dr. There's a question here. As an autism parent, on the part of speech and comprehension, I'm really struggling. She's asked, the parent is asking for help. What's your comments?
Yes, so that is a very serious challenge, and it's a very important challenge that most parents face. So what I usually say, number one, is to manage our expectations as parents, as doctors, as teachers, as caregivers of children with autism. A lot of the times we find that we compare these children with their colleagues or their peers. So you hear your sister's child is speaking 200 words, and we want our child in the spectrum to also match that. So the first step is to accept that the child has a challenge, and to give the child expectations that are appropriate or that are achievable by this child. So number one, set expectations that are achievable for this child. Then seek the help that is available to you. As I've mentioned, we have speech and language therapists, speech and language pathologists who are trained to offer therapies. But we realize that it is not accessible, and it may not be affordable for every parent. There are small things that we can do at home and at school to encourage the child to speak. We've talked about, coming down to the child's level, face level, eye level, so that they can see how you are forming your words when you speak. Do not speak long-winded, difficult words like the ones I am using right now with a child in the spectrum. Use small, simple words. Instead of saying, nani amekwambia uweke hiyo kikombe hapo chini? Vikombe zinawekwanga hapo chini. Toa hiyo kikombe, peleka kwa sink. You have not communicated, and you have not helped this child to learn new words. Instead of all that, just tell the child, Fred, peleka kikombe jikoni. Simple and short words. Simple, short words that the child can understand and can learn. Be patient with this child. It may not take 2 weeks or 3 weeks or 4 weeks for this child to learn a word. It may take even 2 or 3 months. And in other places where there are resources, if you notice that your child completely is not able to verbalize, to remove words, there are other ways of communicating. You can use pictures instead of words. You can use sign language instead of words. There are places that even replace words with gadgets. There are things we call speech replacement gadgets. So instead of a child speaking through their mouth to say, "Mom, give me milk," they actually have a gadget like an iPad where they can point to to pictures of the word. So the iPad has a picture of mom, a picture of milk. So the child will tap on mom, milk, and then the gadget will produce those words, and the parent will be able to understand. So there are many ways of communicating to a person. It's not just about speech. Speech is good, yes, we would like to speak, but speech is not the only way that you can communicate to a person. You can use signs, you can use facial expressions, you can use pictures, you can use other gadgets to communicate to a child. So in case the speech is completely, out of it, don't give up and say, now my child is not speaking. There are other ways you can communicate to this child. But yes, you can try and bring out somebody's speech by, communicating with them more frequently, interacting with them more frequently, using simple language, using positive language as opposed to negative language. The same applies to comprehension. Don't measure your child's comprehension by the standard regular tests. Don't give your child, nowadays in CBC, there are all these exams. Don't just give them an exam paper and then expect them to, color or add 1 + 1 to get 2. And if they don't, you say, oh, now this child is not comprehending. Find ways that your child, would like to be taught and would like to understand. It may not be easy to find it, but after some time of interacting with this child, you may get to understand how they like to understand, to be taught, and how they would like to comprehend. Majority of children in the spectrum learn by observing, modeling, and learning from what they see others do. So if you want your child to learn how to brush their teeth, don't tell them go brush their teeth. Let them see you brushing your own teeth, and then they will model that behavior. Yes, next.
Thank you, Daktari. Is autism preventable? Can we screen parents for the risk, like with sickle cell disease?
Is it preventable? I would say maybe a little bit, and not in the way like sickle cell where you can do a blood test and see. The only way I would say it is preventable is if you do a genetic test for specific diseases that can come with autism. As I mentioned, there are specific diseases that come with autism, like Fragile X syndrome, tuberous sclerosis, Smith-Magenis. These are diseases that can be tested for genetically. So you can, if you have a partner, let's say mother and father, they can go for those genetic tests to see whether they carry that gene that has those diseases. But a lot of it is just by observation. And it's very hard to notice adults with autism, because by the time you're an adult with autism, you have probably learned how to cope or learned how to adapt. So you'll find a lot of adults with autism are speaking, they're working, they're just living a normal life. So it will be very hard for you to know, that this person has autism, or this person is struggling with, had a challenge when they were children of speaking. But just perhaps we also don't want to encourage stigma, because once you start testing people, then you'll say I won't marry this person, or I won't have a child with this person, and then that encourages stigma. So I would say very little of it is preventable by basically doing genetic tests to test for diseases that come with autism. So that is the limited space or the limited window that you may have to prevent autism. But there is also a type of autism we call institutional autism, which is not real autism, but it is a person who is having autistic behaviors or autistic tendencies, basically because of the environment that they are in. For example, if you go to a children's home, or children who have been born in a jail, or children who have been born in an orphanage, you may find majority of them being diagnosed with autism, but it's not that they have autism. It's just that the environment they are in does not encourage social interaction, does not encourage language development, does not encourage emotional expression. So nowadays we have children who are growing up in autistic-like institutions. You find a child is in the house the whole day, they are watching TV the whole day, they're not talking to anybody, nobody is talking to them, nobody is playing with them. So this is a child who might have delayed speech, they might have difficulties expressing themselves emotionally, they might have difficulty forming relationships. It's not because they are autistic, it's just because the environment that they have been raised in does not encourage those abilities to of communication, socializing, or interacting with people. So in that situation, yes, that kind of autism is preventable by just changing the environment. Yeah.
Okay, thank you, Daktari, and thank you for the questions. This is, I think we'll pick the last, since our time is far much gone. What are the chances that you can have a second-born that is autistic if your firstborn is in the spectrum?
Yeah, I would say higher than average population. So if you have a firstborn who is autistic, as we've said, majority of the autism is genetic. It's spread from generation to generation. So it means there is a gene, or there is a blood, something in your cells when combined partner to partner that brought out the child who is in the spectrum. So that means if you have a second-born, there's a higher chance that the second-born can be in the spectrum also, compared to the average population. But it does not mean that all your children will become autistic. It just means that there are specific genes that can be passed on by this combination of partners that can make a family have more than one child who is in the spectrum. So I would say a bit higher than in the average population.
Okay, Santi Daktari. Now, Mary, as we wrap the questions are coming in. Can institutional autism be reversed? Do seizures accompanying autism go away with time, or are they lifelong?
Yes, institutional autism can be reversed. You just need to change the environment. So as soon as you change the environment, it may take time, but yes, it can be reversed. Seizures accompanying autism, it may be difficult to go away because most of the time the seizures point to a brain challenge. So it may be difficult to go away unless it's maybe like a tumor that's causing the seizures, or a specific part in the brain that's has a disease. So maybe if surgery is done to remove it, but usually they require to be on anti-convulsive drugs most of the time for the rest of their life, for a long period of time. So it's unlikely that they will go away.
Okay. So Vivian's question for today, I think, will truly be the last. Can virtual autism be reversed?
Which autism? Virtual.
Mm.
Is this the one for gadgets and screens, or which one is virtual? Yes, it can be reversed. It can be reversed if, let's say, our children are not developing language skills because they are constantly in front of the screens, in front of TVs, in front of gadgets. Yes, when we take them away and we talk to them and we give them the language and we interact with them, yes, they can learn how to interact. Yes.
Okay, thank you, Daktari. And to our participants, if you have any more questions, just try them in the chat section. We should be able to, after this, just engage Daktari and send you the answers on email. But we really do appreciate, Daktari, thank you for your time. And just before you wrap up, I know you have said a few things that you do, but you can tell us more, just a little bit. Where can people find you? How can they contact you? And which other services do you offer?
So as I said, I'm a pediatrician and I've also done ABA diploma. So I offer behavior therapy. I am found, well, for those who, I work for Kiambu County in a hospital called Igegania, but I also consult for Nairobi Hospital. So those are the two hospitals that I can be found. But I also do home visits, school visits. I also offer webinars and trainings such as this. I also offer family counseling and family trainings on how to handle a child who has been diagnosed with not just autism, but other neurodivergent situations such as ADHD, cerebral palsy, autism, a lot of oppositional defiance disorders, and just basically parenting challenges that most parents and caregivers may face. I can be found on Twitter at mdifabilities, on Instagram at difaba. I have a website, www.difaba.com, and I have a phone number, 0737. I'll just type it, 0737 195 080. So that's how to reach me.
Okay. Okay, that's your phone number. Daktari, please also type for us your email, the one you've mentioned, just for somebody who may want to reach out to you. So we just want to say thank you to you, Daktari, for this very informative webinar. We are really, really grateful.
Thank you very much for having me.
Karibu. And now I want to bring in Dr. Jemima to also say a word and talk about what Dr. Jemima, what she does, what Wheels for Life is all about in just in the next few minutes. Dr. Jemima, karibu.
Thank you so much for having me. Thank you, Dr. Lillian. It was really, really an amazing time having you with us today. We've learned a lot. Wheels for Life is an organization that helps pregnant women and also moms who have delivered. So we get a lot of questions on delayed speech and autism and cerebral palsy and the likes. And so when we met with Caroline of Gifted Gems, it was an amazing time to be able to actually bring all the mothers we have on board and have them ask their questions directly. We currently support 2,000 mothers who are either pregnant or have already delivered. But Wheels for Life generally deals with telemedicine, education, patient education, with such, as you can see, the platform as such as this one. We also do online communities. So we have most of our moms coming in from the Wheels for Life community. And our mainstay is transport during emergencies, especially for pregnant women. We started during COVID as a response to help pregnant women who are stranded. And the women that we have now, we have actually evolved with post-COVID. So we get a lot of those immunization questions that you were hearing about. And it was amazing having a pediatrician who could actually respond to the questions. So professionally, I'm an obstetrician gynecologist. I'm at Kenyatta. So I was doing my master's. Also can be found at MP Shah and at the Wheels for Life Healthcare Clinic, which is actually my mainstay operation. And I'd like to welcome all of you to be able to find us there. Our website is www.wheelsforlife.co.ke. And we can be found on Instagram, TikTok, Facebook on the same hashtag. But most of our content is on YouTube, Wheels for Life _ So I'll just put that on the group, rather here. I'll also put my number for anyone who may have joined in from other spaces that was not Wheels for Life. Really grateful, Caroline, really grateful, Dr. Lillian, be blessed and may the Lord bless you so much. This is an answer to God's call for our lives, for my life, and I'm grateful to see many women just benefit from his work. Thank you so much.
Thank you, Dr. Jemima. We do appreciate what you're doing. It's also quite noble. Asante sana. So as I've been your moderator, my name is Caroline Wadege. I'm the founder and executive director of Gifted Gems, and we deal with civic education on autism and to caregivers of children on the spectrum. We work with you after the diagnosis, what next? Or even when you're unsure, you're seeing there are certain things that are not adding up. We refer you to where you can get help. Like we can refer you to Dr. Kerubo and others where you can get that help. So we deal with civic education, we link you with service providers, and we also provide psychosocial support to the caregiver. So Gifted Gems is just all about the caregiver, letting you know, creating awareness on autism, giving you a shoulder to lean on as you walk on that journey with information. And even as I wrap that up, you can find us. We will send this presentation to all the to everybody who's registered, to all of us. You will find we'll send you the link once it's uploaded. And should you have any other question, just indicate. We should be able to respond to you. There is one of us who Dr. has talked about, other than speech, there are other methods of communication. Kindly visit our social media pages. This last month of June, we've actually been handling alternative communication with the Society of Argumentative and Alternative Communication, Kenya, and you'll find much more about other ways like the chats. You know, how else can you communicate with your child where speech is a challenge? What can you do in the meantime? So please find us on Facebook, Gifted Gems, LinkedIn, Twitter. You will get all that information. So thank you very much. I'll put our contacts here. Should you want to get in touch with us, you're most welcome. And now I want to hand over the program to Dr. Jemima so that she can wrap it up for us. Thank you so much. God bless you all.
Thank you so much once more. Just to say gratitude for this platform. We have extended beyond time. So I'm not so sure if there's any mother who wanted or any parent who wanted to perhaps give their vote of thanks. But in the interest of time, I think we can just pray and wrap up. Please follow all those links that have been shared on text, and you should be able to find this on YouTube or somewhere. As Caroline has said, we'll send this to you. So let's pray. Dear Lord Jesus, thank you so much for being with us, for presenting us with this opportunity to learn once more. Thank you for teaching us that disability is not inability, that autism is not a life, it's not a death sentence. We pray that you just take over and take charge, give more grace and more love to every caregiver here. Thank you for the healthcare workers who are just working so hard to help women, especially Dr. Lillian, who gave her time today. Lord, we pray that you just take over and take charge, help us, guide us, and Lord, may we be an answer to our children's prayers, to our own prayers, and to other people's prayers. Be magnified, be glorified through each and everything that we do, and may your name be praised. We pray this, trusting and believing in Jesus' name, amen. So for those who are of other faith, amen. We are not discriminatory. I think it's just where we started from. So I think we can all live at will, and may the Lord bless you all. Thank you.
Thank you so much. Bye-bye.
Bye. Thank you.